kick off then. Thank you everybody for coming and joining us for today's officially the COVID-19 Outbreak Engagement Board. This is the both the first time that I've chaired a public meeting via Teams and on the web, and it's also the very first time we've had this meeting. So hopefully people will bear with me, and we will get through this. But don't be at all surprised if I go wrong. But Nikki Simpson from our committee services is normally here to put me back on track. As I say, welcome everyone. The first item is just introductions, apologies, and terms of reference. The terms of reference to this board is available. I don't know if I need to go through that in detail. What I would like to say is that this is a I plan and hope that this will very much progress in the spirit of the Health and Wellbeing Board, which acts very much as a partnership board with all people coming to the table, even whether you're an official member or not, being very much valued and hopefully heard. This is a meeting where I really would like to think that we don't need to meet too often. We've got the dates of future meetings in future. Be aware that if, for instance, there was an uptick in infections, if we had local outbreaks, then this board may need to meet more often. So clearly, we seek through the actions that we'll be talking about through this meeting to be avoiding increased outbreaks, avoiding and keeping the public of Reading safe, but to hopefully everyone will be very much aware that we may have to meet more often and meet at relatively short notice, if we need to. We can see what's happening in other parts of the country, and whilst we seek to avoid that, we can't be sure that we will. The terms of reference. So the other thing that's slightly that is interesting. This is a committee of the council, but as I say, very much what I hope will be is a coming together of people of councillors, partners, and community and voluntary groups of Reading in order to address the challenges that we face. It's also a slightly strange meeting in the sense that often, in fact, if not always, some of these decisions will be made elsewhere. This will be an opportunity for us to both look at decisions and plans and strategies that we're developing, but also to hold to account and to understand and to fully get to the grips with if there happens to be decisions need to be made by the council or other partners at short notice in order to combat the virus. So hopefully everyone, you can have a look at the terms of reference on our documents on the website, and hopefully as we progress through, it will become clearer in terms of what we can achieve as a group together. Right, so first of all, Nikki, could you go have the apologies?
Yes, am I unmuted or not?
Yes, you're fine.
I'm fine, okay. Yeah, so apologies from Deborah Glassbrook, Rachel Spencer, Neil Carter, Tessa Linfield, Sam Burrows and John Dickinson. I don't know if there's anyone else that wants to pass on any other apologies.
Okay, thank you. Well, the first thing I'm going to say is I'm going to go through a few. Housekeeping. I have to do the dull chair's announcements around how the online meetings will be recorded, but also if you wish to either say, for instance, give someone's apologies or want to contribute, indicate that you wish to speak, ask a question, if you could please make that contribution in the chat section of the Teams, that'd be great, and I'll pick that up, and Nikki and myself will be keeping an eye on that. So first of all, in terms of the announcements, before we go on to the introductions of the members of the board, I'd like to inform everyone present that this meeting will be recorded in Microsoft Teams and then will be uploaded and available for repeat viewing on the council's website. Councillors, officers and partners attending will be asked to introduce themselves. This is for the benefit of the public and also to ensure the clerk, Nikki, knows who is in attendance and that everyone can hear and speak to the meeting. To help me manage the meetings, I just said, if you wish to speak, please can you indicate on the chat section on the screen and wait to be called. When not speaking, if all attendees could please put their microphones on mute, and then when called to speak, please unmute your microphone and pause for about 3 seconds to allow for the slight time delay in connection. And if you're addressing the meeting, it would be best if you can have your camera on so that you can see who's, people are speaking. However, we are aware that sometimes with broadband services struggling under lockdown, there may be loss of connection, and if that may happen or the connection is poor, you may find it improves if you turn your camera off. So we'll understand if this is necessary. Okay, so as I say, I think we'll now move on to introductions of the board members. There'll be plenty of people here who won't know who people are. So I'm going to go through introductions of the board members and officers and partners. I think the best way to do this, I think, is if I just go through the list I've got in front of me and people can introduce themselves and just say what their position is. That would be fantastic. So I'm Councillor Graham Hoskin. Oh, sorry, Councillor Brock is just notifying. He's going to have to drop out of the meeting at 3 o'clock. So there's a prior appointment. I wanted to give that apology. So everyone. So thank you, Councillor Brock, for letting us know that. So my name is Councillor Graham Hoskin. I'm the chair of this board, and I am the lead councillor health, wellbeing and sport. Councillor Brock, would you like to introduce yourself? We might come back to Councillor Brock. I know he's
You're on mute.
We can come back to Councillor Brock.
Do you know what? This is the problem. You know, I do hate being in an online meeting that I'm not chairing. You know. Anyway, Councillor Jason Brock, leader of the council, vice chair of the board. Thank you for relaying my apologies, Chair, about having to leave at 3, but I'll rejoin after if you're still going. Depends how dedicated people are to having a long meeting this afternoon, I suppose.
Thank you, Councillor Brock, and I'd be quite happy to hand over the chair. It's quite stressful. Hopefully I'll get the hang of this. I'm much happier when we're all in the same room together, but obviously this is the world that we're in at the moment. Right, Councillor Challenger.
Councillor Liam Challenger for Catesgrove Ward and Vice Chair of Adults, Children's and Education Committee.
Thank you very much. Councillor Jones.
Hi, Tony Jones, Lead Councillor for Adult Social Care.
Thank you. Councillor McEwen.
Hi, Chair. I'm Ruth McEwen. I'm a councillor in Church Ward, and I'm also chair of ACE.
Thank you. Is Councillor O'Connell here? Oh, sorry, it's got the.
I haven't seen her yet, Chair.
Okay, thank you. Councillor Robinson. Is Councillor Robinson here?
Yeah, hi. Thank you, Chair. Councillor Simon Robinson, representing Peppard Ward, and I'm also spokesman on health and children's services for the Conservative group.
Thank you and welcome. Councillor Stanford Beale.
Councillor Jane Stanford Beale, also from Peppard Ward, and I'm Deputy Leader of the Opposition.
Thank you. Councillor Terry.
Hello, Councillor Terry, Lead Member for Children's Services.
Thank you. And then we've got the co-optees from the Health and Wellbeing Board. I've got Mandy Baines. Yeah, I know she's here.
Hi, I'm Mandy Baines, CEO of Healthwatch Reading.
Welcome. Andy Czerski.
Hello, Andy Czerski, GP and health representative from Berkshire West CCG.
Thank you. Thank you. Welcome. Nick John.
Good afternoon, everybody. Nick John, the commander for Reading Police.
And I've got, is it Elish, isn't it? McCarthy? Sorry if I've mispronounced that.
Hello, Elish McCarthy. I am Reading Locality Manager from Berkshire West CCG.
Welcome. And Gail Muirhead.
Hello, yes, Gail Muirhead from the Fire Service.
Okay, thank you. Welcome, everyone. I know I said that I'd be also introducing everyone for community groups. We've got quite a few and we probably want to be getting on with the meeting. Would it be okay if when people speak, that they introduce themselves and who they are if they've not yet been introduced, and then we'll know who everyone is. That hopefully that is a good idea, in which case, thank you very much. Is there anything else on that item that we need? I think we've done introductions, apologies in terms of reference, in which case we'll move on to item 2, which is questions from members of the public. And the first question I've got here in my files, well, we've got Sue Piggott. Ask question number 1, Sue Piggott.
Chair, just to clarify, if people haven't seen the questions and replies, I've put them in the chat. So the document should be in the chat, I think.
Hello, everybody.
Right.
I don't know why I'm waving, but hello.
Hello, welcome.
It's a Teams thing, isn't it? We all wave.
Yeah.
Yeah, so I had 4 questions, so I'll read the first one out, and then if we have time to do all of them, that's fine, but I'm acutely aware that I did have 4. So my question was, do we have any data on how many people with learning disabilities or autism have died in Reading due to the COVID-19 outbreak?
Would you like to take all of them? Because I've got all the answers.
Oh, yeah, sure.
Okay.
Connected with that, then, it's just how many people with learning disabilities who live with elderly parents have been affected by COVID-19. How are Reading addressing the loneliness and isolation that is felt by many people who access social care, where services have been reduced, paused or withdrawn? And what plans are in the making? How do we know what people want? This is specifically around learning disability and autism, really. And then the final one is, are there any plans to apply for schemes where technology can be made available for those who are in real need of connecting with others digitally? So yeah, they're my 4 questions.
Great, thank you, Ms. Piggott, for those questions. We count them as all like sections of one, and I'll try and answer them as well I can. Thank you.
Sure.
So, in response to the first and second parts of your questions about the impacts of COVID-19 on those with learning disabilities, we know that there have been 166 deaths from COVID-19 in Reading and a total of 863 confirmed cases. However, at this point in time, we do not have the data on what the number, what of that number had a diagnosed learning disability or autism. Yeah. However, we are keen that the needs of this group are not lost within the system. So when someone with a learning disability develops possible symptoms, access to the testing is designed to be accessible. For example, by allowing a request for testing to be made by a carer on an individual's behalf. If someone tests positive and is identified as having support needs, these are escalated to the council by NHS Test and Trace. If they are from a setting at higher risk of an outbreak, such as a learning disability home, then this situation will be escalated to Public Health England's local expert team to support with the management of the outbreak. In terms of question 3 about addressing loneliness and isolation, Reading Borough Council staff working in learning disabilities and older people's day services continue to carry out welfare checks with people who use services who have a learning disability and their carers. They continue to offer support and advice to carers who are struggling at home and work closely with colleagues in adult social care to ensure extra support in the home is available where needed. A priority has been placed on ensuring that people who use our services continue to receive access to activities to mentally stimulate them during this time in isolation. Staff delivered activity packs and staying well messages directly to homes where digital access could not be accessed. People are now being offered limited access to the Learning Disability Centre where they have the highest need. This continues to be an offer for the most vulnerable who can't be cared for in the home without additional support and access to care and support staff. Staff in older people's day services continue to build relationships with their service users and carers by regular phone calls to offer support, guidance and or chat. Discussions are taking place on when and how a safe return to services can take place. However, ensuring the safety of our most vulnerable residents is the highest priority, and this continues to be a challenge for anyone in the vulnerable category due to the risk of contracting the virus. We will continue to work with voluntary and statutory services to seek the best way forward to minimise risk while increasing social activity. Then in response to your fourth part of your questions, Reading Borough Council leads on the loneliness and social inclusion as a health and wellbeing priority and chairs a regular meeting that is in partnership with many voluntary organisations across Reading representing the views of our residents. During Covid-19 outbreak, the virtual meetings have focused on how do we ensure our most vulnerable residents are connected to the outside world and have the means of access family and friendship, support services and essential services like food supplies. The issue of digital inclusion has been identified as a key area of development, and many partners are working together to address the issue. For example, purchasing iPads for the most vulnerable persons and support to use the equipment. In the meantime, Reading Voluntary Action and University of Reading, along with other volunteer groups, continue to support people to utilise the technology they have by offering over-the-phone technical support to use computers, smartphones, laptops and iPads. Reading Libraries are also offering some digital support. As part of Phase 1 reopening, there are 8 public computers available at Central Library, 10 AM to 3 PM, Monday, Tuesday, Thursday, Friday and Saturday, which can be booked. I think I said Wednesday then, but I shouldn't have done it. It's Monday, Tuesday, Thursday, Friday and Saturday, which can be booked in advance by calling Central Library on the number on 0118 937 5950, and limited help is available from staff. So thank you. Do you have any supplementary? Well,
the only thing I would say is for the test and trace, if people are using a service, I mean, we run a service, Talkback runs a service in Reading, where people hopefully will be coming back to a face-to-face service with us very soon. But if they were to then be unwell and then we have to send them home, what we need to make sure is that we get some sort of feedback from that test and trace, because that could have an impact on how we then run our service from that moment. So in a way, it's connecting the dots up, really. So if someone comes to our service, becomes unwell, goes and gets their test, they are then diagnosed as positive, that will have an impact on how we then go forward with our service. So it's just really being aware. It's not really a question, it's more of a statement, really, that we just need to make sure that there is some robust feedback from that test and trace, because obviously our service will be impacted because we can't run it. So, and we'll have to go back to then doing what we have been doing, which is phone calls and digital FaceTime. So that it wasn't really a question, it was just more of a statement, really.
Thank you. No, it's an important. I'll take it as a question in the sense of how,
Yeah.
Well, what I will take is, I think what you're emphasising, which hopefully is absolutely right, is the need that test and trace element needs to work well. And whereas we know the sort of failures of the national test and trace that we know about, I suppose what I will say is we'll really need to go back to council officers to get an understanding of how effective that communication of the information between us all is working, and to see if there's ways that we can make sure it works as best we possibly can locally.
Yeah. The only other thing, very quickly, because I won't dominate, I promise. The only other thing is a lot of the people that we have been seeing, or certainly have been, engaging with, are not too, I don't want to say happy, but they need some support to be shown how to use those computers and the digital. So just going to the library isn't going to help them. They actually do need someone at their home to show them how to use a computer. So in a way, it's not so much just giving someone a computer, it's actually having someone who's able to show someone how to use it, and use it now, so that if this was to ever happen again, then they've got that ability to, access us or other services, and they're not so cut off, because we have had some people who've been incredibly cut off And it's simply because their supported living provider just doesn't have access to laptops for them, or computers, or even a Wi-Fi signal. So again, it's not so much a question, it's more of just a, you know, that's how things are.
Thank you for that feedback. And well, yeah, it's supposed to be a supplementary question, but that's fine. Clearly emphasising the need for us to make sure we're all working really closely together.
Yeah. And running that blended service, which Talkback are going to be continuing to do, really, you know. So, you know, but yeah, we're on it, but we just need, you know, Reading to say, yeah, go. So we're okay. So.
Okay, thank you very much for that, Ms. Pickett. Thanks for your questions and your contributions.
You're welcome. You're very welcome.
Right, so I've got, I'm not sure actually. So question number 2 from Francesca Roll from the Guide Dogs for Blind. Nikki, are they here? Are we going to?
No, they couldn't come, but I thought you would probably still want it sort of available to either read out or present or in some way.
About communications for people with visual impairment. The written answer that we've done for that can be found on the website, and I'm not sure if it's on this chat, but certainly can be found on the public record. Thank you. In which case, I'll move on to question number 3, and we've got Mr. Tom Lake. Mr. Tom Lake.
Hello, Tom Lake, Information Officer of South Reading Patient Voice and Public Elected Governor at Berkshire Healthcare. My first, would you like the questions all together and then read the answers?
Yeah, I think that's probably easiest. Thanks.
Okay, first question, what are the objectives of Reading Borough Council in respect of COVID-19? I hope these will be helpful to the meeting. Second, please explain the flow of data about people with positive test results for COVID-19 to our local public health team and our GPs. Are full personal contact details available to them? How long after a positive test result, and in which cases? What are the consequences for contact tracing in Reading? And thirdly, informal observation indicates that record keeping at some town centre pubs has become lax, and the wearing of face coverings is also not well observed in some shops. Will the board and the Borough Council act to increase conformity with the laws and guidelines, and could business organisations and business-related social organisations assist in improving this situation? Thank you.
Yeah, thank you, Mr. Lake. And so they are also all very relevant questions to the conversations that we're going to be having shortly. So I'll answer them all in order. In the first one, I'm not entirely clear what kind of objectives your question might be referring to. We have lots of plans and strategies and responses. However, in strategic terms, our overall aim at this point is to ensure that Reading can be a thriving, virus-resilient community. And to achieve this, there are 3 strategic objectives. 1, to ensure that the council itself is resilient and fit for the future. 2, to help people be safe and communities thrive. And 3, to secure the economic future of Reading. And as things, I say, Mr. Lake, as things go on, there may well be objectives within the various different actions and responses that we make around the pandemic response, which may be what you're referring to, become clearer. So in terms of number 2, people with a positive test result are automatically entered into the National Test and Trace Programme. From there, they're given advice, self-isolation, and information obtained about those are considered contacts and also need to isolate. The council receives data on a daily basis on those who test positive, which includes postcode data, so that any local clustering or outbreaks can be identified. The role of local authorities in supporting NHS test and trace system in local contact tracing is currently under review. In some high incidence areas, such as Leicester or Blackburn, who have also had low completion rates on the contact tracing, a role has been taken on by the councils to support a higher completion rate. In these areas, of course, contact detail information is shared with councils so they can undertake this role. In Reading, we already have at the moment a relatively well-performing test and trace programme that consistently reaches or is extremely close to the 80% completion target. And as such, at this time, we have not taken on this role locally. I emphasise at this time. Personally, I believe that the test and trace system should be almost wholly run locally rather than through large national privatised contracts. But clearly, we need to do the best with the situation as it is rather than as we'd like it to be. And then 3, we have established a dedicated team made up of environmental health officers and officers from regulatory services to proactively inspect premises and work with owners to ensure all areas of their operations are COVID secure. This includes, but is not limited to, complying with the test and trace record keeping and face covering requirements. We have also written to all businesses in Reading to outline their requirements for being COVID secure and have established a reporting phone number and email address for members of the public to report to the council any establishments where they have concerns about their COVID practices. Mr. Lake, do you have a supplementary?
No, thank you. That was very helpful.
Thank you very much, Mr. Lake. Right, that's public questions. Next is the local COVID-19 data update. Hopefully we've got David Munday, who's consultant in public health, will give an update to the meeting, and we've got the presentation up in front of us. Mr. Munday, there.
Thank you, Chair. Yes, and hello everyone. I'm, as Councillor Hoskin says, I'm the public health consultant here at Reading Council. And what I want to do is do 2 things with this update, if I can. One is to give a flavour of the impact of COVID on the borough since the pandemic started, and secondly, to give a feel for where we're at right now in terms of current infection rates. So if you can move on to the next slide, please. So this data is just showing us in the line graph on the top of the screen the rate of cases that have occurred since the pandemic started. And the rate for Reading is in the blue line, and then the comparator rates for the southeast of England and then England overall are in the orange and in the grey. And clearly what you see is that over April, we did see a sharp spike in cases in Reading, which then by early May kind of rejoined, if you like, the national and the regional trend towards the decline that we saw all the way through to July. And what we're seeing now is a fairly plateaued situation in terms of infection. And we think, to give a little bit of context to that, places like Reading, which are completely urban in their nature, in their makeup, have seen similar trends to that which is shown on the graph here, whereas more rural areas have generally seen lower infection rates. And that follows, the very simple principle of how infections transmit from one person to another in relation to proximity, whether that's where people's living situation, work situations, etc. The table on the towards the bottom of the slide then just shows us more specifically what's happening in the weekly basis, and it shows the last 2 weeks of August and then going into early September. And over a 7-day period, we're seeing somewhere between 12 and 18 positive cases per day in Reading. So it averages at around 2 a day. Sometimes it's slightly more than that, sometimes it's slightly less than that. But that means that in total, we've seen, since the pandemic started, 864 people positive for COVID in the borough. And it's worth noting that this undoubtedly is an underestimate of the number of people that have contracted COVID in Reading, because the data here are people who have tested positive. So, and clearly we know, particularly in the early part of the pandemic, testing wasn't available for everybody with symptoms. It was primarily available for people who were acutely unwell and being admitted to hospital. which is the minority of cases of COVID. But we also know that some people become infected with COVID and don't have symptoms at all. So for those two reasons, the data based on positive test results, as I say, will be an underestimate. If we move on to the next slide, please. And it's just by way of providing a little bit of context. I'll just pause. I can't see the next slide yet, so I'll just pause for a moment. Hopefully the computer will work to move things on.
Right, we've just had a Teams is frozen, I think, for our.
If you hover over the slide yourself, you should see something pop up on the left-hand side that says slide 6 of 41, and then something next to it saying to take control, and then you should be able to do that yourself, hopefully. Maybe not.
Yeah, I haven't. Oh, here we go. We have moved to the. So hopefully others can see the. There's a map of England on the screen. Can someone tell me that that's what they can see as well?
Yes.
Yeah, I can
Thank
see
you.
that. Yeah.
Great, thank you. So sorry. The technology always tries to trip us up a little. So appreciate this is a little bit small on the screen. If you're able to kind of peer closely, you'd be able to see. It's just because Reading is a relatively small local authority area. This is just to show, in context to the rest of the country, the cumulative cases that we have seen in Reading. So we're in very much kind of in the kind of mid-range in terms of what's been seen nationally, and the color coding on this map is where you've got the darker reds, you've got the higher number of case areas, and where you've got the lighter blues, you've got the lower number of cases. So it's just to give a bit of a feel for what Reading has experienced compared to other areas, and really it's very much kind of in the middle of that range. If we move on to the next slide, there should be another map visible. And this one is just showing rates in the country in the last week. So it's just infections in the most recent week. And again, Reading sits very much in the middle of that range of what is seen, of what is being seen nationally. And that will be slightly clearer on the next slide, which is a table with the Berkshire area kind of summarised. So that might be slightly easier to see and interpret. So just to underline that what we're seeing then, so the first two rows of this table are telling us both the number of cases in 2 weeks ago, in the week that was 2 weeks ago, and then the rate per 100,000 of population. So in Reading, we've seen that as 10.4. And then as we move across the table to the right, we're then looking at the most recent week and the rate there. You can see that in Reading, our rate now is at 12.9 per 100,000. So we are seeing a slight increase in the number of cases in Reading at this point. And that's in line, as you can see, the England number there at the bottom of the table is at 12.7 for the most recent week. So again, in line with what is happening in England, but higher than some of the other local authority areas in Berkshire. Some of that, again, may be driven by the urban nature of Reading compared to some more rural comparator areas. It's also worth just making note, whilst talking about testing, that there has been reference made in the media in the last probably couple of days, maybe 2 or 3 days, regarding the access to testing testing for people, and some stories of people being directed to testing locations in other parts of the country, or not that ones that are that close to where they live. And just wanted to make kind of reference to that, because we know that testing capacity has been expanded quite dramatically in England, and we've seen the benefit of that in Reading by having testing sites at the Highdown School. We've had testing sites at the Medeski Stadium, and there's a permanent testing site just out of Borough at the Newbury Showground, and also another one in Slough that residents have been readily accessing. And in addition to that, people have been accessing home testing kits. So there has been a number of ways that people have been able to be tested. And certainly there are also new technologies that are coming on stream and being piloted in some places, which allow for tests based from saliva, or maybe even the antibody testing being undertaken, so that there's different ways that testing can be done. There has been a requirement nationally to focus the current testing resource on areas of highest incident and areas currently experiencing outbreak, where there's been any demand that has exceeded lab capacity to process testing. So what we're doing in Reading is working very closely with local labs and with the Department for Health and Social Care to ensure that we get and continue to get the testing that we need in Reading, and where there is any kind of bottlenecking capacity because we aren't high incidence or outbreak area, that we get that information through so that we understand where there is any challenge experienced locally. I think it does underline for us in Reading the need for testing to be kind of utilised for those who are have symptoms, which could be COVID, which is this temperature, the cough, or the loss of taste or smell, and testing not being utilised if people are just simply concerned they may have been exposed to the virus, or if they're returned from foreign travel and want to avoid the 14-day quarantine, so get tested instead. And the test is not effective in those kind of situations. It's effective when someone develops symptoms to see if they have developed the infection or not. So I just thought it's worth making note of that, because as I say, in the last few days there's been quite a lot of conversation in the press about availability of testing. The last couple of slides then for me on this piece, if we could move on to the next slide, please, just to give a bit of a feel. This is national data, not data for Reading, but just to show that over the period of the pandemic, what's happened with male and female cases that have tested positive. And we can see a sharp rise in both male and female cases, but then that continued in female and then took longer to subside. And that is more down to the way testing has been accessed than it is down to necessarily the true risk, because actually we think that when it comes to the impacts of COVID, there's been a greater impact on men than women in terms of mortality. And then another way of looking at the population instead of by gender is by age group, and this shows you that if you so if you move on to the next slide, that's the one. Thank you. We've got a sharp rise in the red line, which is 85 plus, and the next sharpest rise and highest number of cases have been in those aged 75 plus, and clearly demonstrating the impact that COVID has had on the older population. But again, some of this data driven by the fact that testing was undertaken primarily in acute hospital settings early on in the pandemic. But that's just to give a feel of the impacts in terms of age and gender. And we've got something later on the agenda in terms of looking at the impacts in a bit more detail based on ethnicity. If we move on to the final slide that I've prepared for the board, this is to look at death in Reading, and I appreciate that it isn't a cheery topic to draw upon, but something we've clearly had to follow closely. And the bar chart that you can see shows the weekly number of deaths, the rate of death, should I say, in Reading, both from COVID, which is highlighted in blue, and then for non-COVID reasons. And what you can clearly see is that there was COVID death quite markedly in April and early May. And really, since the end of May, the blue disappears off the graphs as we have seen a significant decrease in the number of COVID deaths, I'm pleased to say. The grey line that moves across the bar graph is the average number of deaths you'd expect at that time of year, at that particular time of year in Reading. And that's just based on averages from the last few years. So we've even at points now in the summer dipped below what would be a normal death rate in Reading. So that's something that is positive to report. And then the final thing I would just say then relating to deaths is the table at the bottom of the slide just shows you in what type of settings it is that people have died. And obviously, as you would expect, more people have died from COVID in a hospital setting than anywhere else. And that's clearly because people are admitted to hospital when they've been acutely unwell with the virus. You'll note the proportion of people who have died that have been within a care home setting is at 39%. And that's a very typical number that we've seen across Berkshire and in other parts of the country, as sadly, care homes have taken quite a heavy burden from the impacts of COVID. And in Reading, we've developed a care home resilience plan to ensure that our homes are as well prepared and are as in as strong a position as possible to manage the impacts of COVID and to prevent the impacts on their residents, and particularly thinking forward to the winter and possible second waves. And part of what's been happening locally, and this is just to go back to testing for a moment, is that we've been rolling out whole home testing within care homes. So this is a program where instead of simply testing staff or residents when symptoms might develop, it's a program of systematically testing staff on a weekly basis and residents on a monthly basis, regardless of symptoms, to try and identify any the presence of the virus, which might not be present or might not be manifesting itself, should I say, with symptoms. So that's started to happen in Reading, and we're hoping that we get the green light from DHSC to then be able to, the Department for Health and Social Care, to be able to move forward with that being rolled out more fully into September and through the autumn. So that's the other bit that's worth noting on the testing side. So, Chair, I apologize that's taken a little bit of time, but I hope a helpful summary of where we're at in terms of the impact of COVID on Reading and kind of what the data is telling us.
Thank you, David, for that. I think that is really helpful, and I think the details are really helpful and really useful. So I guess the message there is no room for complacency, but keeping a very close eye on the data. And I suppose I was concerned around the issue in terms of testing. I know that down in Plymouth, where they've had some concerns, they're struggling to get testing available for people. So I guess the hope is that the government can ramp up that testing capacity if we were to be in a similar situation here. Right. I haven't had anybody indicate on the chat if they'd like to ask any questions or have any points they'd like to raise around the data that's been outlined there. I don't know if it's so comprehensive and well presented that nobody has any questions. Sorry, it's just it's all flashing up on my screen. Right, so Mr. Cieczerski, you've raised your hand. You may have missed. If in future, you can put in the chat if you wish to ask a question, so I may well miss raised hands. But Dr. Cieczerski, I think you're indicating you'd like to ask a question. Please go ahead.
Yes, thank you very much, Chair. Yeah, I did put it in the chat and then I put my hand up just to indicate there was a question there. Sorry about that.
My fault then. I must have missed the messages about where we can see the presentation.
So yes, I was just saying, according to the graphs that you showed, David, there were very low numbers of positive cases in children. So from the point of view of schools going back now, are there any concerns from your point of view in terms of potential cases that might occur or the consequences of children getting together again in school? I know it's been a big national thing to get kids back to school for their well-being and also for the well-being of their parents.
Yeah, thank you for the question. And what I'll make an initial answer, and Dr. Kate Reynolds, who's our Director of Education, is on the call and was doing an update from the school's perspective on the comms item. So she may want to address this in her piece slightly later in the agenda. But I think that our approach in Reading has been taken the steer from the Chief Medical Officer and his advice for the country, and they've made very clear statements. In fact, all Chief Medical Officers from across the UK have, in terms of schools being considered a low-risk environment for COVID, and certainly, as you've alluded to, the balance of risk of not having children back in school and the delays to development in terms of developing their education versus the risks of COVID very much move you towards saying that children should be going back into school as we're progressing in Reading. Our schools have done a lot of work to ensure that they're COVID secure. So although we're saying that it's safe to do, it's clearly that's safe if the appropriate measures are in place. And the schools have been working very hard with our colleagues in Brighter Futures for Children to ensure that that's in place. So certainly we are confident that that's the right step to be taken, and monitoring closely so that where any flare-ups occur, we can quickly act and deal with those.
Thank you, David. And I think from my perspective, Andy, I think I mean, actually, as somebody's parent whose kids are going back to school as we speak, I think a lot of the evidence and the science has been somewhat mixed in terms of has a propensity of children and young people to transmit the disease. So certainly from my perspective and how I am working with our public health team, I'm taking very much a precautionary and careful approach, and we'll be monitoring and providing the support with the schools very much so. Sorry, also somebody got there. YouTube, can you mute? That's it, brilliant, somebody has. So sorry, David, I didn't quite get when Dr. Kate Reynolds was perhaps going to contribute on this matter, was that?
Well, Chair, she may, if you want to bring her in at this point, I'm sure she'd be happy to. Within the communications update on the agenda, that will partly be from Nikki Barton, who's the comms lead for RBC, but also she's providing an update from what's been happening on the school side as well.
Well, that's fine. If you leave that for that point, that'll be fantastic. We'll keep it together. Thank you. Any other questions anybody has on the information, the data? That I've missed any hands or any notes in the chat, in which case, thank you very much, David, for your presentation. And we can move on to item number 4, which is the COVID-19 Outbreak Control Plan Communications Update, which we were just obviously mentioning. So I've got Professor Dr. Kate Reynolds and Director for Education, and Nikki Barton from Council Strategic Communications Manager.
Aye, and I've got to try and go through the slides as well as talk at the same time, so I hope I manage that successfully. So, hi, my name is Nikki Barton. I'm the Strategic Comms Manager at the Council. Just before moving into the outbreak specific communications, just to kind of reiterate, there's been a communications plan in place for the coronavirus crisis from the start, and was built around the council's priorities, which in the outset were to keep social care services running, to protect the most vulnerable and to help rebuild the economy. And as we now move into, you know, what we might call the recovery phase, but also the sort of longer term, longer tail part of COVID, and also the prevention of local outbreaks, we have new communications approach, which is built into the outbreak plan. The key elements of the plan, just a couple of things I'd say before starting. The first thing is that it's evolving. So what we don't have is, you know, a set plan that we then set in stone and that's it, that's the comms plan. The very nature of the crisis and the very nature of communications means that we need to keep the plan developing and evolving as we go through the crisis. And very specifically, something I want to emphasise as we go through all of this is the extent to which we want to create a loop with our local communities and our local partners and get feedback on the communications that we're producing and on what the needs of our local communities are, so that we continually change and adapt and evolve our communications to meet those needs. It's very much a locally specific and locally targeted plan. So the first thing I wanted to just look at is that the plan has 4 levels of messaging. So we might be in different scenarios as we go through the next 3, 6, 9 months, which align to whether Reading or the wider area are in any of these alert levels. So at the moment, we would, you know, we're in what might be called a resting level. So Graham's already used the words, don't be complacent. That's exactly where we are. So we're in support the local economy, visit your local town, but don't be complacent. So we will be reinforcing public health messages and doing our best to make sure that those reach as many communities as possible. And if, rather than when, if we were to move up those levels and become an area of concern or an area of enhanced support, or we hope not, but an area of intervention, those messages would change, and we would have more emphasis on the actions that people need to take, the changes to local services. As we get more into a state where perhaps lockdown is increasing or there are restrictions on movement, we need to ramp up the extent to which we're making information and resources available to vulnerable people and explaining to them where they can get help and support. So you don't need to read the detail of this table, but the idea behind it is to show how our messaging would change depending on the situation changing, with a real focus on who are the groups that will most need support, how do we get information to people in the event that we go into an area of concern or an area of enhanced support, although our objective remains to prevent that happening. I just wanted to share this with the group. This is what Reading's local campaign creative will look like. So we're following an approach taken by the majority of local councils in the UK, which is to have something which is very locally specific. It's about supporting your local community. It's positive in its outlook, and it's about doing the right thing for each other. It's very flexible, and as we move up those alert levels, for example, we can change this to bring in colours and icons which stress urgency of action or a sort of crisis mode. But this is that sort of resting level, which is just, you know, reinforcing public health messaging. And I just wanted to share that, you know, there's obviously many executions of this, but I just wanted to share that that's kind of the overall look and feel that you'll see around the town. I mentioned this already, but I wanted to give some concrete examples of the kind of work we're doing to create this loop, whereby we don't just create communications in a vacuum. We really work with partners and communities to understand what needs are. So a couple of examples. We have there's a high risk settings team sitting within our regulatory and environmental services area. So this is a team that's been pulled together of officers who would typically go out and visit premises for, you know, environmental health inspections, things like that. They've been pulled together to make visits to local businesses and other high risk settings, such as faith settings, small businesses with close contact like hair salons or nail bars. And that team are out on the ground visiting those settings, asking the business owners, do you understand the guidance? Can you show us what you've got in place to meet the guidance? And then we've got a feedback loop with them where they come back to us and say, you know, business owners are telling us that the government guidance isn't clear on such and such, or we need a translation of this, or the words aren't clear on this, and could you make us a video, or could you produce us an infographic? So that's one example of how we're creating a loop for the feedback on the ground. Another example is around translations. I'll show it shortly, but we've created a translations hub where we're translating materials as people request it, but we're talking to partners about what languages are needed, what formats are needed, does it need to be audio, does it need to be words, and making those all available in a translations hub. So if I could give you one takeaway message from this, it's that we invite your feedback and input. We have pushed out messages to all of council staff, it's gone to all council members, and it's gone out through our social media channels and also directly to our partners. But if you haven't received that message, the contact details are at the end of my presentation, and we invite input into that to help us understand how we can better produce communications and what local needs are that we need to tackle. Just going to check before I move on that I've covered what I wanted to say. I think one other thing I would highlight is we've also had feedback, so thinking about that high risk settings team, we've had feedback about smaller venues finding it difficult to capture the details of the people who are visiting their premises. So we're looking at what might be the solution to support local businesses and other settings to be able to better capture the details of people who are visiting to enable contact tracing, that kind of thing. Okay, just going to move on. So this is just one example. This is an infographic that we co-created working with partners. We developed a concept, we put it out to partners, they gave us feedback about the style of images, about the kind of information that was on it. And this has now been translated, I think initially into 6 languages, but I think we're going up to 9 or 10 languages. We've also got a text-only version of it that's accessible to screen readers, and we can look at doing also audio versions of it. So this is the kind of thing that we're developing in conjunction with partners. And this is the translation hub, which I mentioned. So it's a page on our website where the infographics available, all the translations are available, but we also have on here signposting to all of the translations that have been produced through PHE, the NHS, the World Health Organization. There are a number of organizations producing translated materials, and we're signposting it all from here. And the page is also accessible to people who use their browser settings to automatically translate pages into whatever their preferred language is. So those are some of the ways that we're addressing language needs. We're also working with the hospital to pull together a group of language speakers who will record audio materials for us. And again, I think we've got about 8 to 10 languages at the moment, and we'll be doing either short videos or short podcasts in various community languages. And again, we're open to feedback about what other languages should be in that pool. And this is just an example of the kind of learning that we're doing as we go through this. So I've picked social media, recognizing that not everyone engages with us on social media, but just because it was easy for me to pull together a number of examples. So we picked masks as an example here, and this just shows kind of messages we put out, and then we learn what kind of thing works locally. So we've used some national messages, and you can see, for example, in the bottom left-hand corner, that's some NHS material that we've shared publicly. And what we've learned is that we get more engagement and people are more interested if we produce Reading-specific local materials than if we share the national materials, for example. We also know that videos perform better. 2 of the best performing posts that we've had, so the one in the middle bottom, that is a resource, a printable card that people can print off if they have a reason that they can't wear a face covering. And that was exceptionally popular and widely shared and got people really talking about when they would or wouldn't wear a face covering and why they should or shouldn't, but it was something that there was a reason to share it. Top left, a little bit of humour, treat your mask like you would treat your underpants. That's one of our most highly engaged with posts. So even with something like COVID, you can be a bit lighthearted and, you know, introduce a bit of humour, and that was really popular. And then other posts there about how to make, how to wash, how to dispose of masks. And then the top right is actually trading standards. So this is because we're seeing an increasing number of small businesses try and produce their own masks and sell them. So this is a bit of a watch out to consumers, you know, what to look for, and to people who want to sell masks. So we do ongoing testing and learning and monitor how things perform, what kind of messages we need to put out, and what kind of things people engage with. So that's all from me, other than to say this is the email address. If you do want to get in touch with us, and find out more about the languages, or you've got specific suggestions about communities or languages or materials or messages that you want to talk to us about, get in touch with us through this email address, and obviously it's in the pack and will be reiterated later. But we really do want to kind of get that input and feedback so we can keep developing it. And that's all for me. I think I'm handing over, a bit sad I'm not a professor and a doctor, I'm going to hand over to Professor Dr. Kate Reynolds for the Brighter Futures piece.
Thank you, Nikki. So just to update, I'm Kate Reynolds, I'm Director of Education at Brighter Futures. Just to update what we've been doing in terms of schools, and that came up earlier from the question, we have a web page for school news, which is on the Brighter Futures website. Our communication has mainly been with head teachers, as you would expect, who I think have done an absolutely fantastic job in terms of managing through the lockdown and now in the recovery phase. That's included a three times a week email briefing, and some days that has been, or some weeks that has been daily as well, depending on the amount of guidance and the sort of situation that we're facing. So 3 times a week during term time, head teachers have received an email with lots and lots of information, guidance, picking up from some of the stuff that Nikki has just talked about as well, and making sure that's fed out to our schools. On top of that, we have a weekly dial-in meeting, myself and the Director of Children's Services, with head teachers, so they can raise any specific concerns that they might have. We've also built up our social media presence. As Nikki said, some people are more into social media than other, and use that as a way of promoting messages around COVID safe schools and making sure that everything is in place for children when they return. Just to fill in on that, like the chair, I was at a school this morning, one of our schools in Reading, and I have to say they've done an absolutely amazing job with arrows and signage across the school, with hand sanitizer. Everybody has to write down, every visitor has to write down who they are and how they can be contacted. So an awful lot of work has been done on that. We've then in the last couple of weeks done an awful lot of work with our colleagues in transport in the council around school reopening. That's included an interactive web whereby parents can log onto the web, and children as well, and work out the best walking or cycling route to school. So that's partly because we want to encourage people to do that for health reasons, and for both physical and mental health. We know that walking and cycling is a better way to go, and it's partly to ensure that we have sufficient capacity for those pupils who need to use buses to be able to use the buses. Predominantly our secondary schools will start from next Monday, so we'll see how the bus capacity works for that, but we think we have absolutely everything in place in order to do that. I meet daily with the transport people just to check that we've got everything that we need from that side. And our attendance figure on the 2nd of September, so this is for primary schools only, 2nd of September was running at 85%. The national figure is 87%, so we're very close to the national figure. And we had one school where 98% of their pupil population were attending on that first day of term. Where children aren't attending, it tends to be because the family have come back from somewhere and they're now under quarantine. So they've got to get through their 14 days before they can actually go back to school. So we think that's the reasons why that we're running at about 85% in terms of the pupil population. That's really what we've been doing on the Brighter Futures side. We've also been tackling, because I know in the questions, in a sense, some of the issues around isolation and mental health were raised. We've put in new apps, which our schools are circulating for children and young people. And indeed, we have, going through the autumn term, which, as I say, has just started, a whole programme of mental health support with government funding, which will be rolled out to teachers and then into our classrooms. So a lot of work has been done there. Again, like Nikki says, we always welcome feedback on our communications. We've surveyed all our head teachers in terms of what's the most appropriate communication mechanism for them. They've said they're very, very happy with the system as we currently got it, but we're very happy to flex that as needed. We also use those weekly dial-in with head teachers where we have a particular issue that we feel needs emphasising. So, for example, David Mundy has himself been to that meeting and explained to head teachers what they need to do if there are people with symptoms within a school and the action that they need to take. We also feed all of those comments then back up to the DFE. So at the moment, as David said, we are concerned about the access to testing across Reading, and we've pushed that back to the DFE as well. So we're saying that loud and clear. So welcome any questions from anyone.
Lovely, thank you. I have got a couple of questions. I'll bring them in. Thank you very much for that presentation. I certainly, Dr. Reynolds, I completely agree with you in terms of the incredible work, certainly from my experience as a parent, that the schools are doing in order to prepare. And that's before they even start to try teaching the children. And certainly, but following on from that, I suppose, and this is a question both for yourself and Nikki, and it goes back to communications. I completely agree that more localised Reading focused communications, and actually at some point we may even go more local than that if we have particular issues in particular areas in the future, but also generationally. So with kids going back to school, have we considered the role of communication specifically? I'm thinking of perhaps secondary school population around distancing. I think more anecdotally, teenagers are perhaps a biggest challenge in terms of maintaining social distancing, particularly outside of school. And I see places like Plymouth and others have had a whole sort of protect your grand sort of message to young people to give a motivation in terms of understanding social distancing. So in terms of secondary schools in particular going back, we've given thought to that sort of more focused young people's communicating. Then I've got some other questions. I'll bring them in. Thanks.
Yeah, no, thank you for that, Chair. I think that's a really interesting point. We need to work through our schools, and head teachers will take responsibility for that. And I'm very confident they're sending out those sorts of messages to their school communities. Also be aware that in Reading, we have one maintained secondary school, that's Blessed Hugh Farringdon. The rest of our secondary schools are academies, so responsibility for that in terms of messages does rest with the multi-academy trusts that sit behind that. But I know the DFE have talked to them in the same way that they've spoken to us about the importance of making sure that young people understand social distancing. And my early years friends would probably challenge you a little bit and say that actually the little ones are much more difficult to keep apart than the old ones are. But there you go. But that is all in hand, as I say, and we will be working with heads through and making sure that message is pushed out.
Thank you very much for that. So in terms of the secondary schools, particularly thinking about how difficult it is to control what they're up to outside of school. I think the little ones are slightly easier, but I get the point entirely. So I have got a couple of questions. I'm going to bring Mary O'Connell. Did you want to ask this yourself, or shall I ask it for you, Mary? Would you like to ask your question? I think it's an important one. Councillor O'Connell.
Yes, thank you. I'm aware that quite a lot, particularly at secondary level, but there will be some at primary, but at secondary level, we have a lot of Reading pupils who go to schools that belong to other local authorities. How are we working with them? And in the event of a local lockdown, how might that work?
Okay, shall I answer that, Chair?
Yes, please. Sorry,
and David may wish to come in terms of the local lockdown. I mean, I'm in almost daily contact. Yeah, it is daily contact because we have a WhatsApp group for all the directors of education in the South East region. So I have regular conversations with our colleagues in Wokingham and West Berkshire. So we're collecting all that information. For example, when it came to school transport, we specifically looked at the movements into Reading and out of Reading in terms of pupils coming in and going out, and all that work is being coordinated across those boroughs. So that's all in hand. In terms of a local lockdown, I might turn to David on this. I would imagine that I would contact my counterpart in the various boroughs, and he would be contacting his, and then we would tie those messages up together.
Yeah, Chair, would it be helpful if I made a quick comment on that?
Yes, please. Sorry.
Yeah, so I think it's a very good question in terms of local lockdown, and it's a little bit difficult to give specifics without being in that situation, because although we use the term kind of local lockdown, it's fair to say that in different areas there's been different key actions that have needed to happen in those areas where local lockdown has occurred. So we work very close. So in some scenarios, schools can easily remain being open despite being in an area of increased intervention, for example. In terms of the cross-border stuff more broadly, we do have a Berkshire West Health Protection Board designed for this exact purpose. So it's a collaboration between the Wokingham Local Authority, Reading Local Authority and West Berks, together with the Regional Public Health England team and also NHS partners. So, and the idea is that we are working jointly on our patch, if you like, so that we all know what each other are doing, and that the messaging and that any actions are well aligned.
Thank you, David, for that. And absolutely, I mean, I'll second that. The public health, local public health across the Berkshire West is very much coming together, I think, and probably been helped to pull together as a result of the pandemic that's coming across. So it's a really important question, Mary, and I think goes back to what I was saying in terms of communications we need to think about sort of outside of school as well as working with the schools. So I've got Jane Stanford-Beale, Councillor Jane Stanford-Beale.
Thank you, Chair. I just wanted to ask the Director, I'm really sorry I haven't met you yet, but I have to declare an interest. I have 3 children with special needs, and I also run Autism Berkshire, so you can probably guess as to which special needs one of them has. We run an active Facebook page, and we have over 3,000 likes on it. And today we ran a story from The Guardian about children who attend special schools not fully opening, and we've also had children who've been told by their schools, I mean, I hasten to say this is not just Reading, this is across the whole of Berkshire, who've been told by the head teacher that the head teacher feels the child can't respect social distancing, and therefore they don't feel that they can meet their needs in school at the moment. So we know we've got a large number of children at the more severe end requiring AHCPs or going to special school that are not being able to access full-time education at the moment. So what's our situation in Reading, please?
Okay, if I can respond to that, Chair. Thank you very much for that question. I don't have any evidence, and remember we are on day 2 of primaries opening and our specials opening. I don't have any evidence yet that children with plans have been turned away from schools in that way. So if you do have that, really, can you let me know, and I will take that up with the individual school concerned. All our schools have done risk assessments for those children with plans. They did risk assessments in terms of the children when, in a sense, they weren't at school, and they've done using those risk assessments to make sure everything is in place so that the children can come back to school as well. So I'm not picking those things up from what I'm hearing.
That's really good to hear in Reading.
Yeah.
Can I just make a comment about the question from Andy Sikersky about the parental anxiety? I sit on the mental health partnership board across in East Berkshire, and there has been a lot of work that's gone on producing the coping guides that have been distributed in Berkshire West as well to help parents coping with anxiety, because there are a lot of parents who, you know, in July were sort of saying, well, I don't know if we want to send the children back. So there has been quite a lot of online support available for parents in that situation, and we have pushed those guides out, and I know our other partners working on the Future in Mind partnership have done so as well, to try and reassure parents that a lot of work has been done to keep the children safe in school. Thank you.
Andy Cichurski, a little bit of a spoiler about your question. I'll bring you in there.
Thank you very much. Well, it's sort of half answered the question, and it's and again, it's probably early days, but do we have any data on children not getting back to school, whether for parental anxiety or for any other reasons, which sort of alludes a little bit to the previous question?
Yeah, no, absolutely, and thank you for the question. Really, we don't have hard data. We have some anecdotal and data, I suppose, is the best way to describe it. We know over the summer we had 5 cases whereby families were taking the decision that they would, from the start of term, home educate. So, you know, that's 5 out of them. We've got roughly a school population of 22,000. But, you know, so there was a little bit of a spike in that. I've worked with head teachers where we've had 1 or 2 instances where parents are particularly anxious about their child coming back to school. What we've done in response to that is the education welfare service that can work with those families and allay those fears are available for all the schools in Reading, regardless of whether they buy that service back or not. We've made a decision that they will be available to work with those families and to work with parents to ensure that that anxiety level is brought down. And that seems to be working. But I've only had, as I say, it's less than one handful in terms of schools saying to me, we've got a parent who is anxious. So I think, as I say, that gap are sort of 85% up to 100%. Well, I know one of them happens to be because one of our schools didn't quite complete the attendance form in the way that the DFE needed them to. So I think that 85 is a slight underestimate. But we also know we've got quite significant numbers of families who are still quarantining. So that will take another 2 weeks for those children to be able to come back.
Thank you. And I have got a point that Sue Piggott wants to make, which I'll comment in a moment. It's on the education side. As going back to what you were saying, Kate, in terms of the incredible work that schools are doing. But one element of that is around zero tolerance to pupils who are endangering the COVID-safe nature of the school, understandably. Which then brings in a whole new possible avenue of children perhaps being excluded from the school setting. So I suppose my question from that is, are we being very much monitoring what may happen in terms of pupils not being excluded from the school setting and around the continuation of their education? It's a little bit of a new sort of a new scenario for us, isn't it? But I wanted to raise that.
Yeah. Thank you very much, Chair. Again, another excellent question. I think there's two bits to this. First is that we always monitor exclusions extremely closely, and I have a team of people who will pick up on any, again, we're going to use the word spikes, aren't we, quite a lot. Any spikes in exclusions, something which is out of the ordinary, they will immediately deal with. And sorry, I've now forgotten the other bit of your question. My apologies,
Chair. I suppose it was how do we deal with that in terms of sort of the education or online education or the systems of working, I guess, to make sure that
No, that's a really, really good point. But remember, of course, that for a number of our schools, particularly the secondary sector, but also the primary sector, during lockdown, they were providing remote learning. So they know how to do that. They've now got quite significant experience of doing that. So that if for any reason, we do have, and it may happen in the event, for example, of a local lockdown, they are able to switch quite quickly to remote learning for children. That's all in place.
Okay, thank you. Yeah. And Sue Piggott had raised the question. I guess this is for everyone here. Can we make sure that easy read is provided around the communications for those people with learning disabilities? If that's been considered yet, or Nikki, that's pretty one for you.
Yeah, so I did see that, and that's a great point, and it's definitely in the mix of what we want to do. The thing that would be really helpful, and this is the kind of loop we need to get into, is to know exactly what is needed in easy read. So there's an enormous volume of communications. If I use translation as a kind of analogy, we've had requests for everything from the entire Outbreak plan to be translated, and it's 150 pages, through to translating the infographic. But we've got information about masks, we've got information about distancing, about testing. So we absolutely want to produce that stuff. But what would be really helpful is to start to get that insight as to what are the messages that we think are most important to provide in that format. Because it will take some time to get through all messages. So if the need is specifically about social distancing or specifically about face coverings or whatever, that's really helpful for us to know, and we can move to those areas. So I'm doing the slides in the chat and everything. So if the person who put that comment in could contact the email address directly, then we would love to.
Yeah, we can do that. Yeah, I could do that. Brilliant, fantastic. I can give you any information you need on that. Absolutely. Thank you.
Great. Well, thank you for that. Really important information and presentations, and I guess stuff that will very much develop over the next until we meet again, particularly around the schools and the communication. So unless anyone has any other questions or points they want to raise, or if I've missed anybody, hopefully I haven't.
Excuse me, Councillor Hoskin. It's shown here. Sorry, it's shown here, Councillor Hoskin. I've got my hand up. I don't know whether you can see it. Sorry.
Okay. Even though, Shoni, have your hand up and have anything in chat, I will. Yes, you can come.
Sorry, I didn't know I was putting the chat. I'm trying to do the both things. Never mind. I do apologise. I'm having some IT issues this afternoon as well. No, I just wanted to kind of pick up that point. So I've sent to David some really good comms that Surrey have done for children and adults with a learning disability, and they're very simple things. And I think it's a bit about, there are things out there, maybe we can pinch some ideas from others. So Surrey had done some really good work, which I forwarded on yesterday, I think it was, or the day before, David, wasn't it, just to look at comms in that nature. So there's people around there, I'm sure we can link with other comms departments to help us as well.
Yeah, I think the key thing I think is that there is a lot of stuff out there. There's definitely good practice. There's lots of things we can borrow. Yes. If anything, the risk is that there's too much information and a deluge. So what we're trying to do is identify specifically what is most helpful and put them in a clear place where people can find it and be signposted. So
totally right, Nikki. We've got to be very measured, but it means we can kind of use some of the stuff or cobble together from a few our own kind of data set. No, that's right. Thank you, Councillor Hoskin. Apologies for that.
Right. No, thank you for that. Thank you. Okay, unless anyone else has missed anybody else. Thank you very much for those presentations. That was really helpful. So moving on to agenda item 5, which is going to be a standing item for this board, and it's about lessons learned, and I guess also reporting back in terms of how we're dealing with local incidents and outbreaks. And as the moment, there are no local incidents, and it would be great if this is one that we never ever have to come back to. But obviously, it is there in case there are any outbreaks and incidents that we need to consider. In which case, we will have that at the future meetings. So there you go. We'll move straight on to agenda item 6. Hang on, I've got different numbers on my agendas, but it's the whether it's 6 or 7, I don't know. It's the COVID-19 impacts on the Black, Asian and minority ethnic communities and how this informs our local planning. And we've got Yasmin Ilsley. Yasmin, this is all yours.
Thank you, Chair. Thank you. Firstly, just to say that I'm having real technical issues, so hopefully I'll be able to get through the slides and the presentation okay. So I'm looking at it slightly differently, but hopefully it matches up. But no, thank you very much. So I'm Yasmin, one of the Public Health Programme Officers here at Reading Borough Council, and I've sort of been looking at some of the evidence around the disparity impacts on Black and Asian minority ethnic groups at a national level, and sort of looking at what that will mean for us here locally in Reading. So if we can go to the next slide, please. So just for context and just to make sure that everyone's on a similar page, what we've seen sort of at the beginning of I guess 2020 in terms of the impacts of COVID, the evidence was kind of looked at to kind of compare the loss of life and ill health sort of pre 2020 and kind of what was happening in the year of 2020, which is obviously sort of linked to COVID. And the trends that we saw were very similar sort of year on year in terms of the impact on age, the impact on gender, deprivation, and the location. So for those people, for the older populations within sort of on a national level, there was more of an impact in terms of loss of life due to COVID. Similar for men, there was a higher loss of mortality, loss of life for men, particularly men over 60, compared to those compared to females, and for people living in areas of deprivation, the impact was greater there. So that was kind of a similar trend to what we've seen in previous times, and as David alluded to earlier, those living in sort of urban areas similar to Reading, where there is a population sort of more closely sort of densely populated, the impacts were seen sort of more greater. So next slide, if we can, please. So this table here just kind of really demonstrates just kind of the impact of age. So as the age increases, the risk of loss of life increases steadily. So those over 40 were 3 times more likely to lose their lives. By the time you get to 80, that increases to 70-folds, which is a huge increase there. Next slide, please. So hopefully what you're seeing now is a bit of a graph which looks at the deprivation levels. So again, typical to most sort of illnesses, people living in sort of deprived areas are more greatly impacted upon than those in sort of least deprived quartiles, and you can sort of see that happening particularly during the peak of the pandemic in sort of beginning of April sort of time there. So that kind of just sort of demonstrates more visually. So next slide, please. So what was different then in terms of what we saw with COVID-19 is the impact it had on ethnicity, but also in terms of certain occupations. And for the first time, what we saw is people from Black, Asian and minority ethnic groups were more greatly impacted than sort of the white communities, which we wouldn't automatically see. And that was what kind of led to the inquiry that sort of the sort of Prime Minister had kind of put forward, which led to the Public Health England sort of data report, but also looking beyond the data, which was the stakeholder report, which kind of did that qualitative side, which I'll come on to a bit later. It also found that the occupation of the person seemed to also increase the risk of the impacts of COVID. So those with roles where their exposure to people, as you might imagine or might expect, were greatly impacted. So those in sort of the security settings and transport, but also, of course, in the care sector, whether that was within hospitals and sort of the NHS side, or whether that was in adult social care with care homes, there was much more exposure in those areas there. The other factor which has kind of come out more recently is the impact that pre-existing health has had on outcomes for people who were impacted by COVID. So people who had diabetes or high blood pressure, cardiovascular disease, and more recently carrying additional weight are thought to be a real driver factor for increasing the severity of illness and sort of poor outcomes there. So that was something to really look onto. And many of you may have seen the national campaign that's out at the moment, Better Health, which is really encouraging people to sort of kickstart their sort of physical health and well-being, thinking about the weight side and encouraging us to kind of sort of eat better and be more active. You know, many people have been able to engage in more activities during the lockdown, but of course people perhaps in those key worker roles who were perhaps facing the brunt of the virus in terms of keeping the country going will have been less likely to have been able to look after their individual health as a result of that. So something to consider going forward as well. Next slide, if we can. So just to kind of dig a little bit deeper then in terms of, you know, what's going on for people of Black, Asian and minority ethnic groups. What you can initially see if you sort of look at it as the face of it, people from sort of the Black community were between 3 and 4 times saw a 3 or 4 increase infold in loss of life during the pandemic, depending if you're male or female. Those from Asian backgrounds, sort of a 2.5 to 3-fold increase, and those from sort of a white population between 1.5 and 2-fold increase. So what they were able to do is to look at other co-factors that I mentioned at the beginning in terms of age, deprivation, sort of areas of living, and they were able to control for some of those factors. And when you control for that, that did significantly reduce the impact of mortality in this particular group. However, it didn't account for everything. It didn't bring that difference down to 0. So those from a Black community were still 1.9 times more impacted, and those from a Bangladeshi or Pakistani background were still between 1.6 and 1.8 fold increase. And a slightly less so for those from Chinese or mixed backgrounds. So those other factors, those socioeconomical factors do play a role, but there's still something else going on which the data that we had so far hasn't been able to kind of completely pinpoint down, although occupation and health are likely to be some of those factors, but there may be others. Next slide, please. So what is going on then? So it's complicated. It's not 100% clear, but the combination of kind of living people from Black and Asian minority ethnic groups, more likely to be living in urban areas. There may be the risk of overcrowding. Historically, there's kind of the deprivation, the type of work that they're doing, as I mentioned beforehand, maybe more likely to be in that sort of key worker, sort of people facing roles. It's also worth mentioning and remembering that if people from a BAME community are more likely to have been born in another country, born abroad, and therefore may have other experiences of healthcare settings. So the access to healthcare, whether that's when to access or their experience of what healthcare may be like, may also be impacted. If there's issues with sort of immigration status and concerns there and sort of preconceptions, that may present as a barrier to being able to access that care there. But also, as I mentioned, the health implications there as well. So people from BAME communities are much more likely to have some of the comorbidities, things like diabetes, high blood pressure. Those factors are more prevalent there as well. And we tend to kind of, and I'm doing it myself, talking about BAME and kind of grouping people together. But even within that, there are the different impacts. So people from Black communities are more likely to have a positive diagnosis. But yet it looks as if the Bangladeshi and Pakistani backgrounds have a worse outcome once they've actually got the virus compared to other groups. So there's a variety of things going on there to consider. Next slide, if we may. So the other piece of evidence that kind of came on to this as well was kind of looking at the sort of the qualitative lived experience for people who had either sort of had COVID themselves or had family, friends, work colleagues who had experienced it. So they'd seen it up close and personal and were able to kind of contribute to this national evidence that was kind of put together. And what came out, some of the key themes that came out of that was obviously there was kind of, sort of pain and anguish at the fact that we were in this position again. So the inequalities that I've described aren't new. They kind of, COVID has kind of brought to the forefront some of these inequalities that are faced within the communities. And so there was a very sort of heavy-hearted in terms of the fact that they were in this position yet again. That said, there was also a great deal of optimism in terms of this provides an opportunity to really turn that around and to address it and to do something about that, and sort of the keenness to make that changes. And I think just from the work that's happening locally, definitely experiencing that in terms of wanting to sort of collaborate and organisations to really listen to people from various different BAME communities to really get it right this time, which is fantastic. So there's kind of the long-standing inequalities, whether it's historic or whether it's systematic sort of racism or discrimination were kind of some of the underlying factors there. There was the stigma, the fear and the mistrust. And so those are some of the factors that we really need to unpick in order to be able to kind of really address that. So I appreciate that that's a long-term goal, but those are some of the things that we need to consider when we addressing this issue. So next slide, if we may. So looking at the local picture, so kind of what's happening in Reading, I just thought it'd be helpful just to kind of bring together a summary of kind of where we are here in Reading. As David mentioned earlier with his slides, we are a largely urban area, so that is a potential risk factor. We do have pockets of higher deprivation, and we also have sort of higher than England average in terms of some of the overcrowding. So those are some of the risk factors that going forward we need to kind of keep account for, although at the moment numbers are very low, which is really positive. In terms of population of Reading, like many areas, we've got overweight is obviously an issue in the majority of people, and although diabetes is prevalent, it is lower than in other areas, which is positive, but is increasing. And so it's therefore making sure that programs which are really helping to reach people who may have, for example, undiagnosed diabetes are really sort of reached. And being September, I guess we are approaching the flu season. And so this year in particular, it's going to be really key to make sure that people are able to get access to their flu vaccinations, because that's going to be really, really helping. And sort of looking at sort of coverage, last year we were just below in terms of vaccination coverage for our 2 key cohorts. So that's people over 65 and also our 2 and 3 year olds. So real efforts to try and make sure that we hit targets this year will be key. So moving on to the next slide, if that's possible. So I won't go through this one in too much detail, but this basically provides a bit of a summary in terms of the key outcomes that have come out of the Public Health England's recommendations. And I've picked up on some of these points in the next couple of slides in terms of what we're actually doing at the moment. But they sort of factor around to improving ethnicity data. It looks at doing sort of community participatory research and improving the communications, which we've already gone through earlier on with Nikki and Dr. sort of Kate Reynolds. So that's definitely a focus in terms of what we are doing at the moment. So looking at the next slide, sort of what action is happening at the moment, there's kind of a twofold approach. It's kind of obviously the key thing is making sure that we prevent against loss of life and ill health through any sort of subsequent waves here in Reading, but also trying to look at sort of addressing some of those longer term issues in inequalities. And obviously we've got the health and well-being strategy, which is currently being refreshed at the moment, which will really pick up a lot of those inequality issues there. But for focus of this, we've got the sort of the operational activities, which include things like the communication side. There's the strategic bit. There's also emerging opportunities. This is, as we know, a novel virus that we're learning and adapting, and it's always changing. And so kind of being able to meet and adapt those needs as they come along, but also building capacity, which I will come on to a little bit later. So next slide. So wheels on motion is hopefully the slide you're all seeing. I'm looking at a very different slide to you because my Teams wasn't working, so hopefully people can see wheels in motion as well. I'm just picking up the comments there. So from a strategic point of view, there's a lot of different activities that are kind of happening at the moment. There's the sort of the outbreak control plan, which has been alluded to on a number of occasions, but this sort of looks at and identifies our high risk settings as well as our high risk population groups. And so looking at, we've recognised that people from various different faith groups and people from Black and Asian minority ethnic groups are going to be more vulnerable, and therefore more efforts are going to be made to ensure that when we are putting out universal communications, that this is being done in a way which ensures that we're not leaving anybody behind. And as you've seen just now from some of the slides that Nikki was showing, a great deal of efforts being made in terms of ensuring that we've got material translated into various different languages, into various different modes, and ongoing work is happening at the moment to make sure that we are picking up the needs of the population that we have here in Reading. Obviously, a lot of the data that we have is from census data, which is sort of 2011. Things have moved on since then, so it's kind of really trying to keep up to date with kind of what the needs are more currently. There's the social inclusion work stream, so there's the recovery groups that's been set up, and one of the subgroups of that is the connecting communities, and there's a sort of a data group that goes alongside that, and that's a very much a new group, but it's a multidisciplinary group with people across different sort of settings. At the moment, it's very new, and it will probably grow as we get clearer in terms of the priorities and how we can best support various community groups, but it's very much focused on recognising who are the more vulnerable communities within our borough, and how best we can support them. So a new piece of work there, but that will be a real driving space in terms of taking this work forward. We've obviously got our Outbreak Control Board today, which we're all in, and that's going to be a really good way of kind of having that two-way conversation to kind of really check in terms of where we're going and what the priorities need to be. Working with a variety of different partners, but I've put sort of ACRE on there. I've been working quite closely with them over the summer months, just to look at sort of improving some of the services that we have at the moment, and understanding kind of, you know, how they work and how they operate, and opportunities to work together there. So that's kind of some of the more strategic sides. And then the next slide, hopefully. Which is what I sort of refer to as the kind of the more operational bits, which I've mentioned beforehand. So kind of developing the infographics alongside with the comms team, supporting and promoting the Better Health campaign, which, you know, as I mentioned before, is the national campaign, and looking at kind of making sure that our programmes like health checks and promoting physical activity remains on the agenda. So it's very much looking at how we can all keep ourselves as fit as possible to prevent any sort of ill effects from COVID. So the last slide, I think Nikki's sort of done the spoiler there for me, but just kind of re-showing some of the infographics and some of the information that is available on a national level as well. And then sort of coming to the last slide here, so it's kind of thinking about future opportunities. Obviously, we're going to be working towards the recommendations that PHE have sort of put forward. Data collection is massively improving, and I think in terms of where we are today, we've got much more information in terms of cases that are coming through and the ability to map them than we had previously. I think one of the key areas that we're looking to kind of take forward is that kind of participatory research. And we're looking to sort of recruit to a new sort of community engagement officer who will really help to drive some of this work forward and some of that work around the engagement and the research that's needed to really carry this forward. So exciting times ahead in terms of taking that forward. But that's it from me. So thank you very much.
Thank you, Yasmin. That was really, fascinating and a really good presentation. I'll come on to how we ensure we maintain focus and momentum and progress. Sorry, I realised I was muted then. I said some nice things about you, Yasmin, in your presentation, and I said that I'll come at the end about how we ensure we sort of maintain sort of focus and progress and momentum on those actions at the end. But first of all, I've got Jane Stanford-Beale who'd like to ask a question.
Yasmin, thank you very much for that. It was really interesting. I know I'm going to sound like a very sad counsellor now, but I have a son with severe asthma who was under the Royal Brompton. So I actually, during lockdown, would look at the data on an ONS level basis, which I know most people didn't do because I've asked questions before about it and they've looked at me as if I'm very strange to actually look at SOA data. So we know that there's across Reading, there's a very uneven distribution of the number of cases and sadly the number of deaths from people. The research by King's College London was that air quality seemed to have an impact as well. Have we been able to do any mapping on that? Because one of the great things about lockdown was that people stayed at home. They did do what they were asked to do. They didn't take their cars out, and it led to a really good improvement in air quality in Reading. Unfortunately, we're seeing the traffic rates go up. I haven't seen what the data is yet about that. So that's my first question. And the second one was around particularly the Asian community. They do tend to have predisposition towards diabetes, and with diabetes you can then get the kidney disease and you can then get hypertension as well. And up in Bradford they showed that they had a lot of people who came in and were very ill in a hospital, and they tended to be people who had undiagnosed diabetes and undiagnosed kidney disease. So are we having any pushes to try to get into that community to try to get them tested so we can get them onto treatment earlier to try to prevent having very ill in hospital? Because they felt very much in Bradford that because we've had the first wave, that they will be much better at managing people if they do get very ill with using steroids, using antivirals and using the positive airways pressure machines to try to make sure people don't end up ventilated in intensive care, which is what the issue was before. Thank you.
No, thank you, Jane, for raising those. So 2 very good questions. I will start with the second in terms of looking at sort of specific community groups. So I think in terms of, as you sort of said, sort of that undiagnosed diabetes is particularly key to pick up. Obviously, just from the fact that it's a horrible disease to have in itself, but also the wider implications. And so I think programmes such as the NHS health checks, which have been around for a long time, now seems at the forefront in terms of a really useful tool that can be used to help pick up people with those risk factors, whether that is the high blood pressure, whether that is undiagnosed diabetes, whether that's the weight issue, to kind of really help to make those lifestyle changes so that the risk factor is lower. And so that's one of the areas that I'm very keen to sort of see sort of take forward. So I guess once the COVID initially hit, it was one of many sort of activities that were put on pause, or recommended to be put on pause, just to kind of prioritise the I guess, to do the initial firefighting. But we're now at a stage where the green light has been lifted in terms of restarting those programmes. So I'm going to be working quite closely with sort of the CCG to kind of really help to get that back up and running again, and to sort of prioritise particularly GP practices in areas where we know that there is a higher population, of particularly of sort of Asian and Black community groups. So yeah, really key area to sort of focus on, and is definitely on the radar in terms of going forward to kind of to really reach those messages, but also that universal promotion of healthy lifestyles. In terms of the air quality, I may let my colleague, my boss David, to come in on that one, because he may know a bit more than I do. So David, you're welcome to take the floor from me.
Thank you, Yasmin. I indicated to the chair that I'd happy to pick up on that. I think it's a really important point that you make about air quality. And one of the things we know is that clearly air quality just generally is a determinant of health, and one we are taking action on within Reading. We also know that it isn't an evenly distributed determinant of health, and that people in more deprived areas are more likely to be exposed to more air pollution. So it clearly is an important issue. In terms of being able to correlate directly where air quality has remained problematic or where it's got better because of COVID, and what's happened in terms of mortality or the impacts of COVID, it's quite hard to draw straight lines between those 2 factors because of a number of other contributing factors around around people's kind of health, etc. But what I would say is that the council's been active in promoting active travel, and has received some central government grants to support wider pavements, cycle lanes, to be able to redesign some road areas so that active travel is kind of more possible. And I think the ambition is that we would make that a sustainable approach for the people of Reading. And you're right, traffic levels are kind of rising again, but there's an opportunity that we still have to try and embed a more active travel approach to our work kind of in Reading. And that's something that, from the public health perspective, we're very much connected with and engaged with, along with our kind of transport planning colleagues. So I hope that gives a little bit of an answer, but maybe doesn't completely answer the point raised on the air quality side.
Yeah, thank you for that. I would say that although I fully support active travel and getting people walking and cycling more, unfortunately the scheme that we put in last week in Caversham did not go down well, and I did write to the deputy leader on Tuesday asking him to remove it, and it was duly removed. I think it was probably the Facebook campaign rather than my letter that actually helped on that way. But I'm still pushing to get a set of traffic lights with the pedestrian phasing, because I think then that will help people walk down the hill, because at the moment it's very difficult to cross the road, and if it's difficult to cross the road, you're going to take the car instead. So thank you for that one.
Yes, thank you, Jane. And we never say we get everything right all of the time, and we obviously listen to everybody. So thank you for your contribution, in response to that scheme. I think it's also worth saying that air quality was one of our priorities before this pandemic, and the development of the transport strategy, having a much greater focus on active travel and schemes to improve air quality in Reading, because actually it's been a determinant of ill health. It has been causing ill health for quite some time, as you well know, Jane. So hopefully we'll be getting, your support in driving forward a lot of those schemes. I mean, obviously you can expect to support all of them, and we appreciate your input into that. But that's very much a driver in terms of that transport strategy and improving air quality in Reading. I've got Mandy Baines with a question.
Hi, thank you, and thank you for that presentation. I just wondered, and I noticed that one of the areas that we need to improve on is data collection. And I wondered if we have any data on the number of BME people that have been affected, either test positive or who have sadly lost their lives, and what communities they may be from. In reading our current outbreak plan and statement, one of the things I think that has been highlighted, not just looking at the BME communities, but all of those marginalised real communities that have been disproportionately affected. I wonder about not having enough information to produce an adequate equality impact assessment to go alongside this, because I think that feeds into actually, are we able to really get our comms and get our work down to reach those people that really need it the most? Because there's a lot of effort being made at the moment, and I think that might be an important part. And I just wondered if we have any recent data around that.
No, so thank you, Mandeep, for raising that. So I think the data side is, as you mentioned yourself, is one that we're definitely trying to improve. And I think in more recent weeks, in terms of those people who are going to be tested to get those results, we are now collecting sort of ethnicity as a routine way going forward. Obviously, it's not always sort of indicated when doing the test, which is an area that we need to work on. But going forward, so if we were looking at the last 3 weeks or so, we do have a rough number. And I guess I didn't want to put any slides up because the numbers are very small. I didn't want to sort of identify, but if we were looking at the last 3 weeks of the cases that we had, 42% were from white backgrounds, 16% were for some white other, so that could have been sort of Rome Gypsy travellers, for example, and then the other 42 was from BAME groups, which, if we think that about 25% of the population is from a BAME background, then that is an overrepresentation. So kind of what I was talking about in the beginning is very much sort of the picture that we're sort of seeing here, and that breakdown, if we were to break down that BAME group further, the biggest proportion would have been those from an Asian background, which correlates to kind of the biggest BME group that we have in Reading. So it is something that we're definitely improving on, and that just gives a snapshot. I think that literally landed in my inbox this morning, so that kind of went up to the 1st of September in terms of those proportions. But sort of going forward, I sort of alluded to having a sort of an engagement officer, and I think the ambition for that role is to really connect the various different sort of activities that are happening. There is a lot of work in this area, but I think it just needs to kind of be pulled together a bit more so, and kind of to really sort of map out kind of where we are today to really help inform what we need and what we don't, so that we're not producing lots of excess material. It's kind of producing what's needed in the mode that's most user friendly and accessible. So I hope that answers your question, Mandeep. Thank you.
Thank you for that. Somebody's got their hand raised and I can't see who it is. And they put their hands down. So I don't know if somebody wishes to speak. Andy Cheshirski's got a couple of questions, and I think rather than on the chat, Andy, would you like to ask them?
Yeah, sorry, my mute button disappeared off the screen. Here we go. Yes, I'm just thinking early throughout lockdown, it was quite evident there were more people out walking, cycling, possibly even running or doing whatever they could to get some exercise. And there was some evidence, I think anecdotally, maybe, I don't know if there's any strong evidence, that people took permission to exercise as a sort of a rite of passage from lockdown to be able to go out rather than being stuck indoors. Is there any evidence that that has been maintained, or has that been dropped off, not just amongst the BAME community, which again, anecdotally, there may you might notice that there were more people from those communities walking and cycling? I don't know. And the other thought was also, with the big push for the cycling lanes in Reading, whether there are bike counters out on the road, and whether there's evidence that the number of bicycles being ridden through Reading is higher than it was pre-COVID, and actually could we maintain the higher numbers if they are there, with promoting the safer cycling facilities that we're trying to promote?
Thank you, Andy. Not sure if we necessarily have the answer to that right here. We might need to go back to some of our transport colleagues for the second question, but did anyone want to respond?
I was going to say, I'm happy to jump in for the first one in terms of physical activity. I might have to consult transport colleagues for the cycling bit. But sort of Get Berkshire Active sort of work across the whole of Berkshire, and they did do a survey, which I'm very happy to sort of share, so that that's available to kind of go alongside with this. But it sort of followed on from a national sort of piece of research to look at what was happening in Berkshire, and we had a good uptake in terms of people doing the survey here, and I guess it was a mixed picture, was probably the best way to describe it. There were lots of people feeling that they were able to do much more and sort of enjoying being able to sort of do activity at home, sort of online, or actually going out and gardening or walking and cycling, as you sort of alluded to, Andy. But there were also some people that felt that they were doing less, possibly because of closures of leisure centres, for example, so not able to swim and use the gym and that type of thing. So it was very much a mixed picture. In terms of sustainability and whether that's still happening, that was done sort of towards the beginning half / I guess once lockdown sort of went from its very rigidness to kind of a slightly more relaxed lockdown. So in terms of where we are to date, I don't think, or I'm not aware of any sort of evidence to show whether that's been maintained or whether that's kind of, we've sort of slipped back, but would be very interested to kind of to understand that myself. But in terms of during the lockdown, very much a kind of sort of mixed picture in that sense. I can see Jeanette's hand up, so I don't know whether she's got anything to offer to support or add to that, so I'll let her jump in.
Yes.
Thank you. I was just going to say there was a rapid review done by Public Health England about transport use following lockdown, and not surprisingly what that showed was that initially there was a drop off in vehicle transport of all sorts, more cycling, more walking, but then private car use has come up back up quite considerably. People have not been using public transport to the same extent, so it looks as though people who would normally rely on public transport seem to be still walking and cycling more than they did before lockdown. But a lot of the people who have got access to a private car are now replacing the private car with perhaps what they were doing during lockdown. That was in a couple of months ago. I don't know if it's been updated, but that was what the initial pattern was looking like nationally.
Okay, thank you. I think there is local transport data, but I think we need to speak to our transport department to get some of their estimates. And maybe that's something that we can bring back when we look at active travel and some of these things at future health and wellbeing meetings as well. So thank you for that. In terms of the exercise, it's a good point in terms of how far. Obviously, we've been focused on returning and opening our leisure centres and sports facilities. There was challenged us in terms of our investment in River Mead to ensure that that was opened. And as people may know, there's across the country a lot of leisure centres aren't reopening due to the losses that the leisure sector is making. So we've been focused on reopening our sports and leisure facilities. And also, it'd be interesting to get the latest data. One of the things that we know that people use in our parks is the litter bins have been overflowing, much more usage. Obviously, as we enter towards autumn and winter, it'd be interesting to compare usage compared to previous years. But actually opening up the usage and encouraging the usage of our open public spaces and our parks is, I think, is really important as well. So that's something that we can come back to. Did I have anyone else indicating? Don't think I did, in which case, thank you for those questions. I think it's really important that we, as I said, that we maintain this momentum and progress. And I do think that, I know there's work, bringing together some different facets of the work across the council. This is such an important area of work. In the longer term, health inequalities is absolutely the key priorities of our developing health and wellbeing plan. But in the shorter term, we've got actions and things that we need to be doing right here. So what I would propose, I haven't actually said to council officers about this, is I think this will be perhaps an item, a report to bring to our health and wellbeing board to give some structure in terms of the actions, maintain focus, and bring together other elements. So I think this is, this is the impact of inequalities in terms of impacts of the pandemic, as well as long-term health inequalities, is obviously a scar across the country and Reading, and something that we can really focus on, redouble our efforts, I think, in terms of what we're doing here in Reading. So I propose that we bring a report to Health and Wellbeing Board on the impacts of the pandemic upon the Black, Asian, minority ethnic communities, and reducing those inequalities, both in it will naturally be both in terms of the virus, but wider health inequalities as well. So hopefully that will sit well with our council officers, because it's a really important piece of work. And as the people have said, thank you, Yasmin, for bringing that, and the work that you've been doing and our officers have been doing. It's really important. So thank you. Unless someone's got anything else to add on that, we can now move on to nearly the last item, the local outbreak control plan development. David Munday, you've got a verbal report on this, or you can say something.
Yeah, thank you, Chair. I've got just 2 slides to present to the board and to people on the call regarding the outbreak control plan. So just to give a piece of context, and then we'll touch on a couple of areas of detail, but I will keep it brief and conscious of time. The focus of, or the purpose of having an outbreak control plan is that we in Reading have a plan about 2 things. Firstly, how we do the relevant and important things to prevent as much as we possibly can outbreaks in the borough, and then secondly, how we respond as and when outbreaks occur. And there's a requirement on all local authorities to be developing these plans. And I use the kind of present tense because these aren't plans that will stand still or, when written, sit on a shelf, but they are things that evolve and continually need updating. But clearly at the beginning of the pandemic, what we saw was a fairly evenly spread infection across the whole country. London maybe saw more of the infection before other areas. But it was a fairly evenly spread rate of infection. And what we're increasingly seeing now, and I'm sure people will understand this from areas that have been in local lockdown, for example, is far more variable distribution of the virus around and about various parts of the country. And therefore, it's important that in local areas we have plans and processes in place so that we're able to make the response that Reading needs, which may be different to what London needs, which may be different to what areas in the Midlands need, etc. So that's the context. The plan is structured around the 8 themes that you can see on the slide there, and that has been taken from our executive summary, which we published in right at the end of June, to give the kind of high level flavour of what's in the plan of the things that we are working up and the areas that need to be covered. One area I just want to pick up then is regarding our high-risk places or our high-risk settings. So that is our point 2 within what you can see on your screen. And Nikki made reference to our high-risk kind of settings team, which is made up of regulatory services, environmental health officers, who are doing proactive work with a range of settings in Reading to ensure that they are operating in a COVID secure way. So that includes cafes and pubs and restaurants, it includes retail, it includes offices, it includes factory-based work, depots for distribution, and it also includes other things like places of worship as well. So taking a proactive approach to understand and to support, to understand what practices those places have established, but then to support where needed to ensure that they kind of meet the required guidance and the required practice to be COVID secure. So that's just one of the bits that the plan works on, but you can see the overall, the 8 themes that are within it. If you move on to the next slide, one of the things the plan then seeks to do is to give some definition to the kind of actions and how we'd go about responding if outbreaks do occur within the borough. And you can see that some of the different points on the slide in front of you. It's important to note that we've been given local powers by central government to be able to take action locally. So if we have an outbreak within a pub setting, within a workplace setting, within an office, you know, it could be in a variety of settings. We have the power that's been delegated to local authorities to be able to take actions there. And if things need to be closed down as the safest way to protect residents in Reading, then we are able to do that. But clearly, that's not by any means the first thing that we would do if we get an outbreak within a particular setting, and that sits within what's called the contain framework, which is what's been, I think, referred to as the watch list, and also where people refer to local lockdown. And just to explain, then there's 3 kind of levels of that. There is the level of an area of concern, where rates are rising and closer observation of the data is required. There's then areas of enhanced, and that was an area, so people may have picked up that a week or 2 ago, Slough was identified as an area of concern, although I'm pleased to say actually Slough's infection rates are dropping again quite significantly now. But that's the kind of first rung of the ladder, if you like. And then there's the enhanced support level where, for example, more testing capacity would be directed to a local area to help understand what's happening with the virus. And then the third level is the area for intervention, which is what's being referred to often as local lockdown. So those are the 3 steps of the, if you like, this contain framework. So in Reading, we're not on any of those 3 steps at the moment. So have those powers and have that framework kind of ready, but is not something at this stage I'm pleased to say, are having to use. So there's lots more I could say about the plan, but I just wanted to keep it at that kind of overarching level, which I thought that would be most useful for the board. The plan itself is structured in 2 parts. So there is a kind of a general part with quite a lot of common themes, which will be similar to other authorities in Berkshire, for example. And then there's an element of the second part to it, covers all of the Reading detailed bit, you know, listing all the care homes in Reading, might list all of the schools in Reading, would talk about who the specific officers are within the council that are leading on certain areas. So it goes into the local kind of nitty-gritty detail. So I'll stop there, but happy to take any questions if helpful, Chair.
Thank you, David. Yeah, any questions, anything, any points, anything wants to raise? I've got Andy Czerski, please. So to you.
Yeah, thanks, David. I was just wondering at what level can these sort of measures be employed? At sort of how granular is the data that to say over what geography we need to employ these things? At a ward level, for example, could Caversham be locked down rather than the whole of Reading, for example? Or are we talking here about following people specifically through the testing and tracing type of approach, where you're not locking down whole areas but actually isolating people individually more, or is there somewhere spectrum between the two?
Yeah, thank you. A really important question, and I think the truth is it's a bit of a spectrum between the two, and it's a little bit of depending on the situation, the response is then is kind of nuanced to reflect that. So, for example, if we were seeing issues within Caversham specifically, then it may not make sense to be in lockdown in Whitley, because it may be that the issues are not the same. So absolutely, the Director of Public Health powers that have been delegated are so the powers that have been delegated to the Director of Public Health, are able to be as specific as they need to be. We get very granular data now in terms of cases that are testing positive. So where it needs to be, as you say, not so much, let's say, a ward area, but instead a particular kind of cohort or grouping of people where there has been a kind of rise in cases, then we're able to kind of identify that and make the isolation, etc., specific to a particular cohort. So I think it's a little bit both and it is dependent on the situation in front of us.
Great, thank you, David. And I suppose the only other thing to, sorry if I missed it, all the delegations to officers within councils have sort of been put in place so we can respond extremely rapidly if required, but with this appropriate consultation with the Director of Public Health and perhaps councillors and whatnot. And then we'll have this board, if we need to make, in fact, if we need these measures, this board will then be where that will then be almost publicly accountable, where we will be presenting the rationale and the reasons why, and be open to challenge, but also communicate exactly why we'd be doing those sort of things. So Andy has sort of followed on. Could it be down to the level of a pub people went to? So I'm not quite sure if that's about tracing. David, do you want to answer? We actually discussed this matter just the other day, didn't we? It's sort of a pub scenario.
Yeah, no, indeed. I'm asked about pubs quite a lot. So I've been doing some personal research to kind of understand the issues. I think it's fair to say that, and some people have reported to me that they felt that some institutions have been really tight on obtaining contact tracing information of customers coming into a pub, and other institutions have been less so. And that's part of what this high risk setting teams are doing, is ensuring that where there's any premises that is not happening, that they're helping establish that to be in place. But absolutely, we would be able to, if either through contact tracing, it's identified that there are a number of people that have tested positive who report that they've been at a certain pub, we would be able to, if necessary, close down that pub until we were happy that cleaning had happened, operations were in an appropriate way to reopen. Maybe wouldn't be the very first thing we did, because it might be we just needed to understand the situation better and kind of work with the owners of that. But absolutely, it could be specific to a pub or a cafe or any other setting. The other thing I'd say, which Nikki referred to earlier, is that where any establishments have concerns, that because they may pick up, it may not be through test and trace, but they may pick up through customer feedback or through word of mouth or on social media, that there are any cases associated with a specific setting, they're able to contact our emergency operations centre. So that email address that Nikki had given at the end of her slides is our all things COVID contact address. and raise that with us so that we can do the appropriate investigation and join with PHE and Test and Trace to get the information and the insight. So it could work in two ways, either informally, if you like, from an establishment, or if you like, formally from Test and Trace identifying a particular site.
Thank you, David. And I've got sort of a final question about how the local health services will be linked into this, will be involved. I guess that could be whether they'd be actually the area of concern or be about involved in the processes.
So I think that's an important point, and I think you're absolutely right, Chair. It's possible that a healthcare setting could be a place in common for people that have had infection, because we know that sometimes infection does pass around in those settings. So you're right, it could be that is a place of, if you like, common exposure. I think in terms of engaging with health services regarding the outbreak plan, I think that there's quite a lot of connections that I think it probably still need to be made in that area. I think that getting some of the messaging out is really valuable, and that health services can support that. I think that most people have a very high trust for their GP, for example. I think the NHS is a well-trusted brand, and I think some of that, some of that communication that we've been talking about locally can be well supported by health colleagues, as I say, with their kind of very much trusted kind of professional health expertise, and also because of the local insight that, for example, lots of GPs have of the areas where they practice. So I think there's links that can be made there, and maybe can be made more strongly to support how we do communications. And then, of course, when we move on to the brave new world of vaccination, that's going to be an absolutely fundamental part of our COVID control plan locally, because we at some point anticipate, we don't know for sure and we don't know timings, but we anticipate being in a position where we will be vaccinating residents of Reading against COVID, and clearly that's going to be a vital role for health services to play. So there's a couple of areas where I see that the links need to be made, and that's probably not an exhaustive answer, but I hope that's helpful.
Thank you, David. And NHS Chelsea makes the same point about needing to link into primary care or have information and data and intelligence, and to make sure isn't ignored or overlooked or missed out, and to make sure those connections are strong. Okay. Do we have any other questions anybody wants to raise? I haven't seen anybody. In which case, David, thank you very much. So that was our last main item. The last one is dates of future meetings. I sort of said a fair bit of this before. The slide will come up, but the dates of the future meetings, as I say, will be we're sort of planning to intersperse them between the Health and Wellbeing Board, because we can report back to Health and Wellbeing Board a number of the things that we're bringing here. So rather than have it sort of double up, that seems to make sense. However, as I said right from the beginning, if we need to meet more sooner than that, or more urgently than that, then we absolutely will do that. So I suppose I'll leave that. We'll put out the dates. We'll arrange that date sort of about a month, roughly about a month after the Health and Wellbeing Board, and then fingers crossed, everyone, that we don't meet before that date in which would be November. If we meet before then, obviously that's not necessarily good news. So thank you everyone for coming along. I think hopefully it's been hopefully this has been a useful meeting, and I don't look forward to. Hopefully we're meeting in November in terms of this, but obviously we'll be progressing a lot of the issues that have come out of this meeting, a lot of the really helpful recommendations, and particularly about developing our partnership links, as well as we'll also be coming back to these matters on the Health and Wellbeing Board, which Andy is helpfully let me know is the 9th of October. So that's when we'll be meeting in terms of the Health and Wellbeing Board. So I have nothing else more to add. Thank you ever so much, all the presenters, really good presentations, and everyone who's attended. Thank you. Who's the meeting? Thank you.
Thank you, Chair. Thank you, everyone.